Now, what would you do if you cut your finger while chopping some of the vegetables? How would you even deal with a child that has just been chopped due to food? Or how do you deal with someone who's just had an asthmatic or even a heart attack? Remember some of the other disasters that happen on a daily basis. Remember some of these minor injuries or minor disasters that happen can be dealt with, but all you need to do is what to do and also the right supplies that you need to have. On my Doctor Show today, we're talking matters, some of the first aid tips. In studio, we'll be having a group of people. We'll be having two experts from St. John's Ambulance to just take us through some of the tips or some of the first aid tips, including asthma attack, including heart attack, including how to treat some of the burns and the right supplies to do or to have. And remember, you're welcome to be part of this show. In case we've left out some of the tips that you need to know, you're always free to talk to us and tell us which one do you want us to demonstrate for you, because we'll be demonstrating right here on My Doctor Show. The SMS line to talk to us is free of charge, 20268, and the call line will be displayed at the bottom of your screen throughout this show. My name is Purity Museo, and you're watching My Doctor Show. Once again, you're welcome to be part of this show. But before we start our show today, we want to have a look at some of the home remedies for first aid. Welcome back. You're watching My Doctor Show, and my name is Purity Museo. Today we're talking matters first aid tips, some of the tips that you need to know or that you need to have while at home, how to deal with some of these heart attack or asthmatic attacks, or even burns, choking for kids, and so forth. You're welcome to be part of this show. The SMS line is free of charge, 20268, and the call line is 0791 478 990. And now help me welcome our special guest today from St. John's Ambulance. Next to me is Fred Majiwa, right? Yes, and you are the communications officer for St. John's Ambulance. We also have Anthony, yes, right? He's also from St. John's Ambulance. You told me that you are the trainee or the training officer for St. John's. Welcome to the show. Thank you. Yes, and today we're talking about something really important that everyone needs to know. First, before we could even start, just tell us what you're having here on our table today.
Today we have a few items that we use to train people. Right. We have dummies. This is for adult. Then we also have dummy for a child. Okay. Then we also have first aid kits. These are very vital kits that you need at home or even at workplace, because emergencies happen anywhere and you never know when you will need one. Okay. So this is what we have today, and these are what we'll use to show a little tips on first aid.
Right. I think we should start with the children. Some of the problems or disasters there are for children. Yeah. Maybe you could take us through some of them and we see how to go about them.
Yeah, the most common emergency that affects children is choking. Right. Because young children, they're like vacuum cleaners. Anything that they find around, they want to push into their mouths. So it's good that the people who handle children, like the nannies and even their mothers or parents, need to know how to do first aid for choking, which is very simple. So when it comes to handling a kid who has choked, you'll see first the eyes are bulging and maybe they become watery. So, and the baby may be trying to cough. So if he's trying to cough, you just encourage them to cough. But if you can see something in the mouth, then you just use the small finger to remove it. But if you can't see, you don't do a blind sweep. Then if you can't see anything, then you turn the baby facing down on your palm. Then you protect the head and the neck area. But in most occasions, you'll find maybe the baby is heavier than your hand, so you can support on your lap. Okay. So once you turn the baby facing down, then you'll give 5 back blows. 1, 2, 3, 4, and 5.
That's now for choking?
For choking.
And how do you know that a baby has been choked? How do you differentiate between a choke and just a normal cough?
You'll see, for instance, when the baby is choked, you'll find, especially the eyes, they bulge and they start becoming watery over time. And even the breathing will be affected. So, you know, choking is a very serious emergency, because if you delay for more than 4 minutes before you intervene, death is likely soon after, because the brain constantly needs oxygen all the time. Definitely, all the body cells need supply of oxygen. And the supply of oxygen, you must breathe in air, which is containing oxygen, then that air gets into your blood, then that blood is pumped into the body tissues. So if your neck area is blocked through choking, then it means the body is not getting adequate oxygen. And for young babies, their body has not fully formed. So choking can easily cause death to them. So once you finish the 5 back blows, then you turn the baby facing up, then you give chest compressions. Again, 5 using the 2 fingers. So 1, 2, 3, 4, and 5. Then you check. If you can see an object from the mouth, then you use the small fingers. You use the small fingers because the baby's mouth is usually small, so you don't use the other fingers. Then that's what you do for babies. Yeah.
And after the first aid that you've given the baby, do you still need to see a doctor, to take the baby to see a doctor, or that would be all?
If you do a cycle of 3, that is 3 back blows and 3 chest compressions, and still the choking object has not come off, then you need to continue the process as you take the baby to hospital. Because just like I said, the body tissues constantly need oxygen, and if you deny it for more than 4 minutes, death is likely soon after. That's why you need to continue with the chest compressions and the back blows. After 3 cycles, then you rush the baby to hospital.
And other than objects in the food, can a baby be choked by just having the meal itself?
Yes.
Is it possible?
Yes, that's why you should feed the baby using small pieces. You don't give large portions of meal when you're feeding the baby. And maybe you're giving the food more frequent, and maybe most of the food boluses are still stuck in the neck area. So you should be very keen to ensure that you are gentle when you're feeding the baby.
And do we have choking in adults?
Yes, though not common like children. Yeah. So when it comes to choking in adults, then the procedure is slightly different. Maybe I will use Tony to demonstrate. So if Tony is choking, I will encourage him to cough. Yeah. If it does not change, then I will come behind and put one of my...
Maybe you can move closer.
Oh, yeah, sure. Yeah. I will come behind and put one leg in between, and then I will support the stomach area. And then I will give 5 back blows. So 1, 2, 3, 4, and 5. If the object has not come out, then I will make a fist of my finger, then just locate somewhere where there is the navel, then slightly above, then I will push in and upwards. So 1, 2, 3, 4, and 5. Again, I will repeat that cycle of 5 back blows and 5 abdominal thrusts, 5 times each. Repeat that cycle 3 times. If the object does not come out, then it's a real emergency which needs to be rushed to hospital, and the doctor should be able to attend to it. But there are some maneuvers you find sometimes you are alone. So you can use the edge of a chair or the edge of a desk. But also when it comes to pregnant women, you cannot do the stomach thrusts. So you'll do the chest thrusts, just at the chest, not at the abdomen. Then if it's somebody who is obese, maybe your hands cannot go round. So you can do it around above the shoulder and below the armpits. Then you push in 5. 1, 2, 3, 4, and 5.
Okay.
Yeah, so there are so many maneuvers that you can do.
But that should help that particular person.
Yes.
Right?
Yeah.
And maybe that would be all for choking.
Yes.
We could move into nosebleeds. They're very common.
Yeah, probably Tony can take us through
that.
Yeah, nosebleed is common and happens maybe due to the different conditions like changes in temperature. You find someone moving from a place like Mombasa to Nairobi, then because of the temperature changes, they begin to nosebleed. So we say that nosebleed is a self-treat process.
Right.
So what you're supposed to do is you sit down the person, lean them forward, then tell them to slightly pinch the soft part of the nose and breathe with their mouth, then hold it in place for 10 minutes. 10 minutes will allow the bleeding to stop, and then the casualty will be okay.
Right.
Yeah.
What is the first aid for nosebleed? How is it like?
Generally, just sit the person down. Then
maybe we can use, I don't know, can use for the kid?
For this one, probably I'll just demonstrate myself.
Okay,
right?
no problem.
So if you sit down, then pinch the soft part of your nose, leaning forward, and then, of course, by that time, you're now breathing with your mouth. Hold it in place for 10 minutes. Holding it in place for 10 minutes allows the blood to be able to stop bleeding. Most of the misconception that is there is that people do not hold for 10 minutes and you keep on leaning your head back. But when you lean your head back, the blood flows back into the nostrils and into the air passage, and then it induces vomiting, which again does not make the bleeding stop.
Okay.
So just hold it in place for 10 minutes, and then after that, look to see if it has stopped bleeding. After bleeding, clean the nostril area and then also dispose the waste correctly.
Yes, and now we want to talk of, because many people, once your nose bleeding, they tend to hold your nose, but now lean backward. Just to prevent, there's that notion that it will prevent the blood from coming out. Just keep talking to us. The SMS line is 20268, the call line 0791478990. We are talking matter, some of the first aid tips that you need to know at home. We've already talked about choking for kids, and now we are on nose bleeding. Keep those SMSs and those concerns coming. We have Fred Majiwa from St. John's Ambulance, and we also have his colleague Anthony Murungu, right?
Yes.
Who is the training officer at St. John's Ambulance. So what are some of the myths or misconceptions for nose bleeding? Because many people, what are some of the tips? Maybe you could take us through one by one, because most of the people do hold their nose and lean behind. Are there some dangers that could come with that?
Yes, the dangers of leaning behind while holding your nose is that the blood, instead of clotting, it flows back into the air passage and into the trachea, which means that the smell and the taste of the blood can make someone to begin to vomit. And with that, and the person is nose bleeding at the same time, it makes breathing quite difficult, which eventually the casualty can collapse because of that. So we are not allowed to tilt the head back. And then again, the other misconception is that some people tend to hyperextend the neck backwards, which means there is a risk of even the blood flowing even to part of the back of the head, which is a bit risky for the casualty at that moment.
Okay.
Yes.
The other thing that people need to avoid is talking while holding the soft part of the nose, because the reason for holding is to try to make your body relax so that the clotting can occur. All
right, and we just want to stay with the bleeding. We also have emergency cut, you know. You're doing something and you just cut yourself. How do you stop that bleed?
How to stop all bleedings mostly is just to apply pressure in the area of the wound. That will stop the blood by clotting the blood around the area of the wound. Then it usually depends with which type of wound. If it's, for instance, these minor wounds, then maybe there will be not a lot of bleeding. So you will only need to prevent infection by washing the area with some clean water, maybe with some detergents, and then you can cover with a clean bandage, or if you don't have a bandage, you can still cover with a clean cloth. But the cloth need to be non-fluffy. Those fluffs need not to be there, because when they go to the wound, they prevent faster healing. So that's basically first aid for cuts. But it depends with the wound. If the wound is, for instance, deep, you may not need to clean the area. Your priority will be to prevent the bleeding. Because if you lose a lot of blood, you may go into a condition called shock, which means your body has less supply of blood than it than it needs.
Right.
And that can be very fatal. If somebody bleeds probably for more than 30 minutes, death is very likely afterwards.
Okay.
Yeah.
And after how long do you expect the bleeding to stop?
Probably in about 10 minutes, the bleeding shall have stopped.
If it persists, then you need to
Yes,
see your doctor?
yes.
Someone is asking, I think in regard to what you're talking, what's the first aid tip when you chop your finger while cutting veggies at home?
Oh, yeah, that's very important.
Right.
Henry will explain how to handle the amputated part.
Okay.
But generally, the first aid is the same. If you chop part of your hand, then you should stop the bleeding by either tying something around it. We normally use tourniquet. I don't know whether we have one here, so that to show what. So generally, when somebody has chopped off the the hand, there will be excessive bleeding. So there is always need to stop that.
And do we have different kinds for, do we have extreme and minor cuts? And do you treat them the same way?
No, minor cuts, normally there will not be a lot of bleeding. Okay. But the deep wound cuts, there will be excessive bleeding. And the only danger with the cuts is the excessive bleeding or the loss of blood and infection. Those are the two main things that you focus on preventing. So when it's a minor wound, there is no bleeding, you focus on preventing infection by washing it clean and then covering with a bandage or clean cloth. Okay. But when it's a deep cut wound, your priority number one is to stop the wound by tying something like a bladder around the area. But you need to take care of the amputated body parts. So Henry will explain, Anthony. Yes. Anthony will explain how you handle the amputated part.
All right, you can go ahead.
So in the instance that maybe you are doing something and you happen to cut off your finger such that it's detached from the other part of the body, you need to preserve that part well so that it can be able to be reattached. If you get the person to hospital within a duration of about an hour and you preserve the part well that was injured, it can be able to reattach and it will function normally. So what we do is that the part that has been amputated, pick it up, put it in a piece of paper bag. So I'll just use this.
Amputated, to make our viewers understand, is the part that has been completely cut
the part
off,
that has been detached.
The areas are separated, right?
Yes.
Okay.
So I will just use this as an instance. So you can put it in something like this. Okay. First of all, the part that has been detached, take a piece of gauze or a piece of clothing. If a gauze is not available, wrap it in that gauzing and then put it in a polythene bag like this. A Ziploc bag is usually good for such instances. Then moisten that dressing for just a little bit. The purpose of moistening it is to help in preserving that part so that it doesn't dry out. Then take it and put it in a cooler pack. It could be in a fridge or some cold water, something that will help to preserve it. And then label it, the name of the person, the part of the body organ that has been detached, and then transport it together with the person to hospital. Okay. Yes.
And what happens to the part that has been left? You tie it?
Yes. Then the part that has been left that was detached, now you handle it like Fred was telling us. Control the bleeding in that area, tie up the area, and then rush the person to hospital. If you get the person to hospital in good time, they can be able to reattach, and the person will be able to use that part again.
Like the case we saw at Kenyatta National Hospital.
Like the instant.
And just make our viewers understand, this could happen especially during accidents, right?
Yes.
And so after how long should that person be rushed to the hospital?
As soon as possible.
Right.
We say a duration of about an hour is good enough, so that at least the body organ will still be fresh, and maybe also to help in controlling things like shock, so that the person will also not bleed out. Because if the person goes into another complication, it means that before they reattach that body part again, it means that they have to go through other medication to handle the other conditions before the part is reattached. So getting the person to hospital is quite adamant.
Okay.
Yeah.
And Anthony, yes, just go ahead.
During that time, you may find the excessive bleeding may make that person ask for water to drink.
Yes.
So you should not give water because it can delay the hospital procedure.
Okay.
Yeah.
Because I understand after an accident there's so much, I don't know, is it because of loss of so much blood that you really want to take a lot of water?
Yes, because of shock, that loss of blood, it makes you want to take a lot of water.
Right.
But you should avoid the temptation of taking a lot of water, because when you go to hospital, it will delay the surgical procedures, which may be necessary. Yeah.
And because of time, maybe can you quickly move now to some of the medical conditions like an asthmatic attack and a heart attack? How do you give first aid for someone who's just had an asthmatic attack or a heart attack?
When it comes to asthmatic attack, you will sometimes find those people with inhalers in their pockets.
Right.
So if you find them with such kind of inhalers, then you just help them to take by giving them. Normally they know how to use it even under that distressing condition. So you just put it on their hand, then you guide them as they use it. Then if the person doesn't have an inhaler, then what you do is you make that person sit in a comfortable position. Sometimes, usually, it's them sitting down and probably leaning a little forward. Then if you see the condition is worsening, then you just take the person to hospital.
Okay.
Yeah.
Is it similar for a heart attack?
No, not at all. When it comes to heart attack, what you do is you make the person sit in a W position or in a half-sitting position. Probably if I use this dummy, let me bend the legs a little.
That's for heart attack.
Heart attack.
Right.
So this is like a half-sitting position. So probably you can kneel behind the person so that he can sit. So this is the W that I'm talking about.
Okay.
Yeah, so once you sit the person in this position, he will be more comfortable as you make the arrangements to have the ambulance come and transfer this patient to hospital. So once he's in this position, then you also need to check some of the people who suffer from angina or heart-related diseases, they have some kind of medication in their pocket. So if they have, again, you can help them to use it. There's an EpiPen which they use to inject themselves. So you just put it on their hands and you guide them to use it. But if they don't have such kind of medication, you may be forced to use aspirin. Aspirin, 300 milligrams of aspirin. So you just give them to swallow. The aspirin, what it helps is that it makes the blood thinner. So the blood will flow easily, because what happens in heart attack, the blood vessels around the heart area are constricted. So the blood is not finding an easy way through. So when you give the person aspirin, it makes the blood thinner and the blood will flow easily. So that is what you do. But in that process, you may find that the heart of the person may suddenly stop. So when it stops, you will need to do something called CPR, or cardiopulmonary resuscitation, basically trying to make the heart start working again. So this is where Henry will help to demonstrate.
Okay.
So in case you have someone who has stopped breathing because maybe of a condition like a heart attack, we do what is called the cardiopulmonary resuscitation, most popularly by people as the mouth-to-mouth or the kiss of life.
Okay.
So when you want to check to see whether the casualty is breathing or not, you come to the casualty, put your hand on the forehead, 2 fingers at the chin, tilt the head back. That way the airway is open. Then you need to look at their chest to see whether there is rise and fall of the chest to indicate whether breathing is present. Then if there is no rise and fall of the chest, breathing is absent, which means you start your CPR immediately. So for an adult casualty, you place your hand, the heel of your hand goes to the center of the chest, the other one interlocks, and then at the center of the chest, we begin compressions, 30 compressions. So we go 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
Right.
After the 30 compressions, now you need to give them some air. So you open their airway, block the nose, and then blow. 1, 2, 2. When you're giving them air, make sure you see the rise and fall of the chest, indicating that air has gotten into their chest and into their lungs, so that you're helping the person to breathe.
Okay.
So we do this as until the casualty is able to respond.
Okay.
Yes.
So after the 30 compressions, and then after you've given them air, what do you expect? The person to wake up or something?
Yes,
right.
when we do resuscitation, we expect the casualty to wake up. But sometimes the casualty may not wake up. That's why we continue doing the cycle until you tend to see response on your casualty, or until help arrives, meaning probably you'd already called for an ambulance, and then an ambulance arrived to the scene to assist you. Or probably you're using a normal means of transport, you've already gotten them to the hospital.
Okay.
Yes.
And when we come back, we want to have a look at why it's important for any home to have a first aid kit, and also we continue with this discussion. We take a very quick breather, and remember, we're talking about some of the tips, first aid tips that you could have, or it's important for you to know, especially at home. We've already discussed some of them for asthma attack, heart attack, for choking for kids, nose bleeding, and so forth. If we've left out one of them that you feel it's very important for us to talk about, these gentlemen are still here on My Doctor Show. Talk to us. The SMS line is free of charge, 20268. We'll also be receiving your calls live during the second and last part of My Doctor Show, so don't go too far. Welcome back to My Doctor Show. My name is Purity Museo, and today we have Fred in studio a team from St. John's Ambulance to just take us through some of the first aid tips that you ought to know at home. This second part, we will be receiving your calls live. Remember, the call line is 0791478990, and the SMS line is free of charge. 20268 is the number. We will also be receiving your calls live here on My Doctor Show, so just feel free to call us in or even send those SMSs. I can see them coming very fast. Welcome to the second part of My Doctor Show. And the very last, maybe we can pick a few questions, right? Sure. There's someone who's asking, I'm loving the show, thank you. Kindly let the gentleman talk a little more about drowning.
Yeah, I think it's very important, especially now there are a lot of floods.
Yeah.
So when it comes to drowning, first is to know that the safest way to help somebody who is drowning is not to get inside water, but to use an object like probably a rope you throw to them, or a long pole, so that they can cling on it, because any person who is drowning will always cling even to a leaf. Yeah, right. So once you throw them something, they will cling to it, and then you pull them off. Okay. But when you get inside, you risk also drowning yourself, because that person will cling on you, and you may not be able to swim, even if you are the best swimmer. Okay. But there are people who are trained as lifeguards. They can always swim inside, and they only do that when they have the right equipment. Okay. So it's always risky to go in yourself. So once you pull the person outside, there are a few first aid that you need to do. First is that person may be suffering from a condition called hypothermia, or an extreme cold condition. Okay. So you need to replace their clothes with the warm ones, and then maybe you can give them something with energy like chocolate to drink, or hot soup, so that it can help them to recover, just to keep them warm. But in some instance, you'll find that they are unconscious. So what you do is that you put them in a slightly slanting position. Right. If this is the person, then the head area will be probably lower than the other cavity, part of the body cavity. So this will help any water that has gotten into the cavity to drain off by gravity. Most people do a mistake of pressing the stomach area, and this can be very fatal, because when you press this area of the stomach, you can push water into the lungs, and this can block the lungs from absorbing oxygen, which can be very fatal.
So what do you do to get rid of that water?
You just make the body slant in a slightly slanting position, and then the water will just come out of the mouth. Yeah.
So you don't
press?
Gravity.
You don't press.
Okay.
You don't press.
I think I didn't know that as well.
Yeah.
For me, I thought you just have to press to get rid of that water.
No.
Okay.
Then if the person is unconscious and not breathing, and you know the process of testing how to breathe is just to feel here, and you also see the chest area. So once you see that there is no breathing, then you start the process of CPR, just as Henry
had
demonstrated.
explained. Okay. Thank you so much for that question. It was really important, especially at this particular time. Hi, please give me tips on how to deal with my newborn baby who cries the whole night. Do you have tips for that?
No, probably when a baby cries, it's an indication that the baby is trying to communicate that they have a problem. You may not know the problem, but if you find it persistent, it's always good to take that baby to hospital so that the doctor can clear the baby of whether he's okay or not.
Not right.
But crying is a sign of discomfort to the baby.
Okay.
Yeah.
And Jonte from Juja is asking, is it advisable to use salt to mulch a cat? Many people tend to do
Tony,
that.
is it?
Not advisable.
Right.
What we would advise is just clean the area with the soap and water, and then dress up the area. Yes, that would be good enough. Antiseptic can also be used in case you have antiseptic, but the tendency that we usually pour salt on it to control the bleeding.
And also some paste.
Salt may have other chemicals in it that can harm the body. And again, if you've ever tried, you will know how painful that can be.
It's really painful, but our parents do try that for us at home. So hand in hand with that, can we have a look at the composition of a first aid kit? You know, I can see there are two. We have a larger one and a smaller one.
Yeah, so the two are different depending on the use. So the big one is normally for workplace, but the small one is a universal kit. You can use it anywhere as an individual. And if you have a population of less than 10 people, whether in a car or at home, this is the kit that you can use. So inside there are a number of items that are really vital when it comes to first aid. The first one, there is a thermometer. This is a digital one, so it's very easy. Once you put it to check on the temperature, then you can read the meter here, and the body temperature normally is 37 degrees. So once it's less than or more than, you know there is a problem.
Right.
Yeah. Then another important thing here is disposable gloves.
Okay.
So this is very important because as a first aider, your safety comes first.
Right.
So when your safety comes first, sometimes the patient or the casualty may be having some body fluids that can cause infection to you. So you wear them to protect yourself from it. It's very important, especially when handling the bleeding. Then there is a cold pack. Mostly when you are injured in terms of sprain or something has hit you, to prevent that pain and to reduce the swelling, you use a cold pack. So you just put it on that area, and probably if it's your arm, you just lift it above.
Just the way it is? Or you wrap it?
No, you just remove the pack.
You
remove the pack.
And place it on top.
And then you place it on top. And then you lift that hand above the heart level so that the blood does not prioritize going there by gravity.
And why is it called a cold pack? Is it because it's cold?
It's cold.
Okay.
It's cold.
All right.
Yeah. Yeah. And it's reusable. Yeah. Then there are other items like the trauma shears. This one you can use to cut the cloth. For instance, when somebody has suffered a burn, you can cut the area around because you don't need to remove the cloth that is stuck on the area of the burn. You just use the shears to cut around. Or if somebody probably has suffered an injury somewhere hidden in the clothes, you don't need to expose the privacy of that person by removing the cloth, but you just cut up to that area and then you assist. Then there are other items like gauze, which you can use. This is an eye pad. You can use it to cover eye injuries. This one you can use to cover any wound. Then once you put it to cover the wound, to prevent infection, you can use another round of bandage to tie it.
Right.
Then there are, these are called alcohol pads. So these pads are already treated with alcohol. So you can use them to wipe around the wound. Yeah, and they will kill any kind of germs that is around that area.
Right.
So these are very important. Then there is also saline water here. If, for instance, you have eye injury, you need to flush it with some clean water.
Right.
So if you have tap water which is very clean, you can use it to flush. But if you don't have, then you can use this one.
Right.
So it's only for that use. Then we have something called a CPR mask. When you are doing, you are giving the rescue breaths during CPR to prevent infection. You use this kind of item, which prevents the casualty's breath from getting to you when you're giving the breath. So you see?
Right.
Yeah. So when you blow through it, it allows air to go one direction and not the other way round. So it prevents you from the casualties infection. So this CPR mask, sometimes when you don't have it and the casualty is having breathing problem, you can just continue with the compressions alone without the rescue breath.
All right.
Yeah.
So how much is this kit?
This entire kit.
Because this is the home recommended kit, right?
Yes. This is only 2,000, and you can get it from any St. John branch. Or even if you give us a call, we can always deliver it to you. So only 2,000, and you'll use it probably for 1 to 2 years. You'll need to come back again to restock the items that you have used. It's very important for everybody to have this either at home, in the car, or even anywhere during small sports or family gatherings. You need to have this one handy. Probably you can only know its importance when you miss it.
Right.
Yeah.
And someone was asking how much and where do we get it. I think you've answered that, that it's only 2,000 shillings and any branches for St. John's.
Yes.
Where are some of your branches? In Nairobi?
In Nairobi.
Or even across the country?
Yes, we have branches in all the former provincial headquarters. So in Nairobi, we have a branch near Parliament. In Mombasa, we have near Tononoka. When you go to Kisumu, at the fire station, we have one. At the Nakuru Showground. When you go to Mount Kenya Hospital in Nyeri, we have a branch. And when you go to Ebru, just behind the county assembly, we also have an office there. So once you go there, you will get all these items.
So, but this one we find it in, this one is in hospitals. Maybe Anthony can take us through this.
We call this an occupational first aid kit. Usually for a setup of any organization that has up to 50 plus employees or staff. So it has a lot of resources that can be used to assist in them. Just basically what is found in here plus additional stuff. With it is also provided a list that in case you need to restock your first aid kit and you look, and it contains also the basic things. And then plus it has a simple user guide that you can use to handle simple first aid skills. So such that in case you're working in the workplace, someone gets injured and you did not happen to know some of the things that you can do, you're able to go through it and you're able to assist. So I'll just mention some of the things that probably Fred Aden mentioned that should be there in a first aid kit. You should have also things like tweezers or forceps in your first aid kit. You should have things like safety pins in your first aid kits. Then the dressings and bandages of the different sizes come in handy. And yes, some things like a thermal blanket. This one is good to treat for shock, especially when someone is losing body temperature. We have what we call the elastoplast, the common ones that are used. And then another essential thing, especially for this kind of kit, it needs to have a notebook and a pencil, so that whenever you use something, you can write it down, or whenever you're handling a situation, you can write the situation down so that you're able to track of what you're doing with your casualty.
Yes. And Fred, for the home kit, maybe do we have a special training each time if I want to come and buy this home first aid kit? Do I get a few training on what is there and how do I use them? When it comes to training, we normally run trainings every day at St. John, but the training starts every Monday of the week. So if you come on any Monday of the week, you'll be able to get trained on how to do first aid, and part of the things you learn is how to use this kit. So the trainings run from Monday to Friday. So if you have time for one day, you do Monday only. If you have time for 3 days, Monday to Wednesday. But it's recommended that you do 5 days from Monday to Friday. So what's the cost for the training? When it comes to training for a single day, it ranges from as low as 2,000, and for the 5 days, it's 5,500 for the entire duration.
Then once you finish, we just help you to do a simple test to confirm that you can go and make a difference by saving other people's lives.
How long does it take? Especially for one who just want to have some few tips for home, you know?
Probably a day or two will be adequate, but the 5 days are normally for those who need it intensively, like at the workplace. They probably need to go for 3 to 5 days. But for at home, even if you spare a day, and normally we organize even evening classes once in every month for those who are busy. And occasionally we also organize weekend classes. So we are just trying to ensure that we build a community of lifesavers, people who will watch at somebody injured and be able to help.
And you'll be giving us your contacts before we end the show. Sure, yes. Anthony, you talked about shock. I think you can answer this question. Hi, my Dr. Shaw. My 3-year-old son had high fever and would not go down even after medication. He later had convulsions and he went into shock. I rushed him to the hospital, but he was pronounced dead. Sorry about that. After testing positive for pneumonia, what advice would you give to mothers for this experience?
For fever, when you notice that the baby is developing fever, mostly there is an underlying condition that would be causing the baby to have the fever. So how do we manage the fever? Most of the time we are told that expose the baby to the outside environment, meaning you remove the clothing of the baby, let the natural environment be able to cool the baby. Then you can take a damp piece of cloth and then try to sort of sponge the baby so that you can cool down the temperature of the baby. While you're doing that, just observe to see whether it's working or not. If it's not working, it means that you actually need to take the baby to hospital urgently. At the same time, if you there's this top-of-the-counter medication that we advise to have in the house when you have babies, the Calpols and the likes, the ones that can help in managing the temperature of the baby. So once you've done that, monitor the baby for some time. If you see no changes, take the baby to hospital, because the underlying conditions, like the case of that mother, is maybe now the pneumonia was causing that. So taking the person to hospital urgently would be able now to assist in that.
Okay, and let's just stay with you, because earlier on you were showing us some tips on nose bleeding. There are like around 6 questions on nose bleeding. I think we can repeat that. You know, how do you? Someone is asking, how do we handle nose bleeding?
Yeah, nose bleeding, how do you handle nose bleeding?
Right.
First of all, if you're in a place that is maybe hot now that causes the nose bleeding, find a place where there is some cold, maybe like under a shade. Then sit down, lean forward, then pinch the soft part of the nose. Pinching the soft part of the nose helps in stopping the bleeding. Hold it in place for about 10 minutes. There are some things that people do, like putting a cold compress on the forehead or cold compress at the back of the head. The back of the head is not accepted because it usually constricts the blood vessels which are leading blood to the brain, which means the casualty may at some time begin to feel some headache and even collapse. Same case goes to people who pour water on the head because they are nose bleeding, that it helps to stop the bleeding. But on the other hand, they tell you that later on they developed headaches because of that. So we are told that instead of doing all that, just sit down, lean forward, pinch the soft part of the nose, hold it in place for about 10 minutes. Usually it takes up to about 10 minutes for it to stop. Sometimes it can go up to 30 minutes, but usually within the first 10 minutes it stops. After 10 minutes, release, check to see if the bleeding has stopped. If it hasn't stopped, hold for another 10 minutes. Again, release. If it hasn't stopped, another 10 minutes. But if it doesn't stop after 30 minutes, think of going to hospital, because sometimes underlying conditions. Yeah.
Okay, and someone else is asking, I think, Fred, you can take us through that. How do you treat scorpion and bee stings?
Yeah, when it comes to stings, especially the bee stings, you'll find the bees leave a stinger.
Right.
So what you do is you try to remove it, either using an ATM card or something that is a bit blunt.
Okay.
Yeah, so you use it to remove the stinger. If you use something sharp, you may cut or push the poison from the stinger further inside, and that may cause allergies. And the biggest worry when somebody is stung by a bee is the chances of that person developing an allergy, especially on the neck area, because that can stop breathing. So you should watch and monitor for signs of difficulty in breathing. If that person is developing allergy, you need to rush that person to hospital.
Okay.
But for the sting, once you remove the stinger, you'll just probably wash the area with clean water and detergent.
And you should be okay?
And you should be okay.
Okay.
Yeah.
Someone is asking, I think they need clarification, especially on the training. Do you provide issue certificates after training, and how do we get to you?
Yeah, sure. After the training, once you pass the exam at the end, then we certify that person. And since St. John is a global organization, that certification works globally in almost all the Commonwealth countries. So whether you go to another country, you'll still be able to use the same certification. So yes, we give certification to confirm that you're competent.
Someone from Meru is asking, do you have a center in Meru, and can I get training at an institution at how much?
We are yet to open a center in Meru, probably in the next 2 months.
Which is the nearest center?
You can go to Ebru.
Okay.
Ebru, we have a branch. Or if you can manage to go to Nyeri, we also have a branch there. So those are the nearest centers.
And you said 2,000 a day?
2,000 for a day, and probably when it goes to 5 days, 5,500.
And if I only need some tips for home, 1 to 2 days is okay?
Yeah.
Right.
Yeah.
Okay, we've answered them. And then lastly, as we wind up, we have someone who is asking again on the baby. I think you answered that. Yeah. And then the ice pack thing in the kit, is it always cold 24/7, or will one need to be like freezing it in a freezer?
Yeah, occasionally you can put it in a freezer, but it doesn't, the coldness doesn't go away easily. So occasionally you put it in a freezer and ensure that it's always cold. Yeah.
Yes, and I'm told that's all the time we had for the show.
Yeah.
Fred and Anthony, thank you so much for coming to my doctor show, and I think many people need this kind of training. We need to have such regular shows, and we're hoping to having you again on my doctor show. And thank you all for watching. Thank you so much for your feedback. Thank you for your comments, your questions. We really do appreciate. My name is Purity Museo, and remember, you can always, or this conversation doesn't end here, because we'll still have them here. You can keep those SMSs coming through the number 20268, or even talk to us on Twitter at Ebru TV Kenya, the hashtag #MyDoctor. You can also download our previous episodes from our YouTube channel. Simply go to Ebru TV Kenya and look for any episode of your choice, or go to Purity Museo and look for any episode of your choice again. I'll see you again tomorrow. God bless.